Yeah, Gannon, if you watch this program on a regular basis, you know the drill. Thursdays, we will always talk medicine one way or another. We'd love to have folks come in and discuss it with us. So November is Lung Cancer Awareness Month. And so for folks who have been recently diagnosed, you may benefit from getting started on treatment right away. You want to do that as soon as possible. That's why joining us in studio today, Lorraine Saminsky is the Oncology Nurse Coordinator Navigator with the lung program at the Zimmer Cancer Center. She's here talking about a multidisciplinary lung cancer clinic for these newly diagnosed patients. How important is this?
This is very important. The sooner they come in, the sooner they get treatment, the sooner they get a cure, and the longer they have to live.
It seems like with everything medicine and health-based, time is always of the essence. We have folks come in and talk about the stroke program at the hospital and how time is very much of the essence when this happens. When you're talking about lung cancer, you will see people, if you feel like it progresses at such a rate at times where it will continue for such a long time. Why is it so timely to get this done as soon as possible?
Well, as soon as they get their diagnosis, they come in. We have a comprehensive program, and we have multiple doctors, a thoracic surgeon, medical oncologist, a radiation oncologist. We all get together, we review all their tests, and we get a diagnosis for them, and we get their diagnosis and their plan of care, and then we bring in the patient and we get them treated as soon as possible. It gives them a better chance of survival, and we get them with their oncologist. They get their treatment, and then sooner they get their treatment, they can get their plan of care, their treatment, and they get their
you hope to see the benefits earlier than later. When you have someone who receives that diagnosis, how much of what you and the group do also may be part counselor, where someone's going through this, you never want to hear the word cancer.
That's correct.
When it's involved with you.
We have social workers that come and help them. We have nutritionists that come and help them. So we're all in this together, and we all get together and help them, and it's just so beneficial for the patient. We have the lung screening, so when they get their lung screening, they can get diagnosed earlier, and that's right there beneficial for the patient.
And these lung screenings, again, correct me if I'm wrong, these screenings now, one can do ahead of any diagnosis. These are almost preventative care now, to where you can be screened ahead of time to let you know what's going on with you inside.
Yes, so if you're lung screening earlier, I always get these LungRad4s where it's, excuse me, it's showing you if you're going to get possibly lung cancer. So they give it to me, and then I will show you in 3 months you should get another maybe CT scan or a PET scan, and then they will get that, and it'll show you again, do you need to either get a biopsy? If you get that biopsy, it may or may not show if you have cancer.
Yeah, again, it's the comprehensiveness that what you're able to offer here locally, where people aren't having to go to Chapel Hill, having to go to Duke. You bring it right home.
And that is such a benefit, because then you don't have to travel all that distance, and we have excellent physicians here, and it's such a benefit to this patient population here.
And it's right here in our own backyard. Take advantage of it. Lorraine, thank you for your time.
Oh, thank you.
We're coming back after this.